So I'll put the recording on. So hi everyone. Welcome to the weekly session VODAN Africa and Asia. So I'm happy to open this meeting, and today we're going to discuss updates on CEDAR localization meeting and the access and control. Yesterday we had a joint meeting on CEDAR localization and also access and control. And then we'll have an update on the special issue. So with this one, I would like to hand over to Professor Miriam to have the opening, some comments. Yeah, please. The floor is yours, Professor Miriam.
Yeah, thank you, Aliyah. It's good to see everyone. Warm welcome. I think that maybe, Aliyah, we can continue from the meeting that we had yesterday on the access and control combined with the architecture, which was a really very fruitful meeting that you led. And maybe we can take some further updates from that, if that is okay. We had in the meeting yesterday, we did a round across the different countries and the main contact persons and the arrangements with the Ministry of Health. So we had an update from Somalia, from Nigeria, from Kenya, from Uganda. Today I can see that Kuda Kwashi is there from Zimbabwe. So it might be good to have an update from your end also, Kuda, if we could ask.
Thank you, Prof. We are still waiting for the ethical clearance on our side. I think with the clearance we can move better to our clinics because of our a bit strict regulations in our health system. Informally, we had approached several potential participants, but their side of being cleared from the ministry. Get it done, I think. Prof.
Yes, so you were breaking up a bit, but I understand that you're going through the ethical clearance and then we'll make the arrangements with the hospitals as soon as that is done. Is that correct?
That's it, Prof.
All right. Okay. Then, yeah, we had we looked at the material for the arrangements with the hospitals. Basically, now we have some follow-up action that needs to be done. Putra has been out of internet, but today he has been able to join as a result of a terrible storm in Indonesia. So there will be Putra can start working on that now that the connectivity is back again. The question that I can then ask is to Mariam, if there is more information needed, for instance, from Zimbabwe on the templates to be transferred into a CEDAR template. Has that already been looked at, Mariam and Kuda? Mariam or Kuda?
To the best of my knowledge, okay. Kuda wants to.
Please, Kuda, go ahead. Kuda?
Maybe he can type it in the chat.
In the chat. Yeah, can you type, Kuda? And Mariam, can you speak in the meantime then? Mariam? I can't hear anything, Francesca.
I think Mariam is trying to speak now. Maybe it's her network, but I can see her pop up. And Kuda is having network problem. I think, Mariam, can you turn on your mic and speak? Or you type in the chat. To the best of my knowledge, Prof, we haven't seen anything from Zimbabwe, but recently we got that of Somalia for the primary health care and the maternal child health care, which I passed on to Aliyah, but the file is kind of corrupted, so she's not able to access to start with the creation of the vocabularies and the templates. So I've requested for Dean Jamal to send in another one, and he promised as soon as he gets into his office, he was going to send. So that is the update for Somalia.
All right. So then I propose that next week we put on the agenda, Aliyah, also an update on the comparison of the different health information systems. And the inventory of that. Getu Samson and Kuda Kwashi, we're going to look at that. I don't know if Kuda can hear us. Kuda, I don't know if you can put any information on that, but the different systems have been shared. And so the comparison of what these systems can do and the localization factor of the systems is a critical thing there. I've understood from Abdullahi Kawu, Francesca Sakinat, that there are different health management information systems used in Nigeria. Is that indeed correct?
Yes, Prof, that is correct. It's not centralized. Each of the states, they have their own autonomous systems, and even the private clinics, they use something slightly different. So whatever we're going to do in Nigeria most likely will be hospital specific. Right.
So that means that there's really quite an important task for this group. There is the system in Zimbabwe, in Pelo, where Hetjan has been providing a lot of important information. There is the very advanced system in Tanzania with Dr. Jeremy, who is also here, who has provided information. Then, of course, we have DHIS. We have the different health management information systems in Nigeria and the one in Somalia. So we really need to get a good comparative overview of those. Because that's really critical to also see what the where the added value of VODAN is for each of those systems. So, Hetjan, I think that the team was going to ask you to help supervise this group. Are you? I think this was just before Samson and Getu left, so maybe the contact has not yet been made. I don't know. What is the update that you know?
Indeed, I don't. After writing that paper, we haven't had contact. But when I hear this conversation, of course, we have open MRT and so on. I would gladly be in touch with the group and support. But I think indeed the group can start bringing the information together, and then I gladly help compiling it and finding common denominators and so on and so on. But I rather have the group working from their respective contexts and then assemble, then starting from a central point.
Yeah, that is great. And is it possible then, Francesca and Sakinat, for Abdullahi Kawu to also participate in that group from Nigeria?
Yes, that's possible, Prof.
All right. And then, of course, there's Dr. Jeremiah. I see you, Doctor. I don't know whether you would also like to work with this group to have the comparative analysis of the system in terms of the provenance of the system, in terms of the data management, where the data are held, and of course also what the health facilities can do in terms of benefiting from those data and having steerage on it. I think from what I've seen, your system is the most advanced available. So it could be valuable for you to also join this group if you had time.
Yeah, I'll be happy to join. So sometimes if it is more like during a day, it becomes difficult, but mostly from where I can see my patient in the ward. But actually afterward, like for now, it was more convenient for me. So as long as there will be a good format for communication, I'll be always there to provide good feedback and some important inputs to improve that. I think it's a very nice approach to do a comparison status before we go on.
Yes. So the information had been shared, but maybe I don't know, Hetjan, I can leave with you and the group to organize that information and any additional information that may come.
Could I ask somebody to set up a WhatsApp group? You know, somebody who has all the numbers of everybody, and just establish a WhatsApp group for this. That works, I think, the fastest.
I would normally I would normally ask Abdullahi Kawu, because he's the best place to do that, I think, but I don't see him today. Can Sakinat, Francesca, can Abdullahi Kawu do this?
Yes, Prof, I believe he can do that. He's not on the call, but I will reach him outside of the call. I don't know why he's not here, and then pass the message across to him and tell him the people to include the group.
Okay, so you've got all the people, right? So Samson, Getu, Dr. Jeremiah, well, Abdullahi himself, then of course Kudakwashi and
Getu. All right.
And perhaps one of the Kenya team, I don't know, Reginald would speak to that. Dr. Reginald, do you want somebody from your team in this group?
Yes, I think we can identify somebody.
The problem is with the Kenyan team, we're so limited in Kenya. It's just Dr. Reginald and Williams, and William is already overburdened. He's in all the vocabularies and the templates group. So I don't know if he's still able to cope with this additional one.
We are getting somebody from Zambezi or Cambridge. We'll see. We'll work on it.
All right. In any case, we'll keep you posted here, and then we will link where we need to link. That's very, very good. Dr. Jeremiah, also, it would be good to complete from your side the, we did yesterday, we did a sort of an audit about the state of the art. You and I had a conversation, but I haven't really shared it yet with the different groups here. So if you like, please kindly take the floor and discuss how the Catholic mission would be participating in the trial.
So you want me to explain a little bit of how our KCMC will participate in this, right?
Yes, yeah.
Okay, so as Professor Miriam has already said about the status of our system that we are using, it is actually we call EHMS system, whereby it's the electronic medical record system, and it collects all the information which are needed, like from when the patient is entering the hospital. Now the information are recorded, payment are done through the system, And all investigation are ordered through the system, and later on they are uploaded again through the system. Therefore, a patient is not working with anything in the hands. He just work with the card or a small paper with a number, electronic system number, where when he shows it, then people can easily see, okay, maybe he's paying for investigation, maybe he's paying for a CT scan or anything. Later on, again, the same system can be used for doctor to review the results and other things. So actually, that is the state that we are having in Tanzania, especially at KCMC, where I work. But particularly in pathology department, whereby we also, there is also a part of morgue where all the wards people do die, and they are all come through the path of pathology department. Then this is the only department which is not yet linked with the data system. And our thought was to make a trial, because all the information that are needed to be collected, they are again brought here in paperwork. So we wanted to include pathology department to see what we can do with the system that we are trying to develop, and see how far we can make it, and maybe what can be done to improve the existing system through the study that will be done in pathology department. So that's what we discussed with Prof. Maria last time. And my hope is pathology department receive number of people per day, maybe almost 10, 15, 20 per day. So this is the significant number. And if we use the paper, we can even understand. If we enter the data to the system, we can understand what is happening. And in the future, maybe we can even start using this system for pathology patients who come for cancer. There are different populations which are also using the paper. Like if someone comes with a referral or come from a doctor with a diagnosis, the age, and all those important information, then we can take the same paper again, maybe enter them in the system and see how this system can make us learn something new with regard to the improvement of the existing system.
Yeah, that's exactly what we discussed, Dr. Jeremiah. So Mariam and Francesca, that means that we would have a different template from here in this case from the pathology department to work with in Tanzania. Are you okay with that, Francesca?
Yes, Prof. That is absolutely fine.
And Mariam says that's fine too. So I will share, Dr. Jeremiah, if you approve, I will share the contact details with Mariam, and then she will follow up with you. A question for you is maybe, is there a data steward in your clinic that you would want to be working on the preparations of this? I mean, it can be done for you, but it might be better within the clinic to really understand the process, and it's also a matter of capacity. Yeah, if you prefer that, we could include some a data steward from your clinic into the program, and then that person can be integrated with the group of Mariam and Aliyah and Dr. Sakinat, who are working on all of these preparations.
So maybe I should work on find someone who can be, because I need permanent person. Most of people who are doing a data steward in pathology, they are mobile, like they come do and move around different departments. So for this one, I think I need a stationary person who can stay here. Especially maybe I can use a data clerk of this department.
Yes.
And so, though technically it's not that advanced in terms of technology, that will be the challenge that we'll have. And maybe let me look young blood from that side again, that will be ready to be trained and get advanced on that. So give me some time, then I'll search and come up with a tentative option.
Yeah. Francesca, Aliyah, do you want to say anything about the sort of the entry knowledge that is necessary for this task, or Francesca or Aliyah?
Yes, Prof. Basically, from our experience for the data steward, we need somebody who has more than intermediate knowledge of computing, really, because we're going to be working with applications, and should be somebody who, if we have an expert in computing, that is better, then it makes it easier, but at least more than basic, more than intermediate, basic knowledge of computing will not cut it. Most of our data stewards, the ones who are really doing very well, are those who actually have backgrounds in computer science and information technology. We have somebody like Professor Miriam, for example, in Tunisia, who surprisingly, she's a medical doctor, but she's doing so well with the creation of templates and everything. Those are exceptional cases. So if we have somebody of that pedigree, that's absolutely fine. But generally, it will be easy to bring the data steward up to speed. It will be important to have that computer science background or information technology.
Dr. Jeremiah.
Okay, if we really need that particular person, personally, I'm good at that. So the issue is only time, that I have to spare my time for sure. But I think I will manage that, because computer is part and parcel of what I do. So I did something on computer. So maybe I spare the time, because to get exactly that person now and bring him to the department is not easy.
Yeah, you may consider maybe the IT person in the hospital will be a good fit, so long as he or she has the time. That will also be a good fit. And the IT person in the hospital, like somebody like Tigist, it may not really be practicing computing per se, but over time, based on the nature of the work in the hospital, having to work with the systems, the computers and everything, he has been able to manage the health, to manage around the health management system. So it's not going to be something completely new. It doesn't have to be pure computer science, but at least that dexterity working with IT systems is important.
Okay. So I think you will need to discuss with Francisca, then maybe in person, then we know who fits on that angle.
All right.
Yeah.
Yeah, or Francesca, would you want to have this first conversation, or should Mariam give an introduction, and so that Dr. Jeremiah gets an idea of what's involved?
I think Maria will be able to do it, because now she's closer to the real implementation than me. So she will be better and a better mentor for the new data steward to bring her up to speed. Aliyah as well is absolutely fine. Aliyah can also do it. So either Miriam or Aliyah, or the two of them, they can do it.
Who would take the responsibility, Aliyah or Mariam?
Maybe Mariam. Mariam is a technical coordinator. Aliyah is technical lead. Let's say Mariam. Mariam is fine.
Okay.
Like Aliyah also has a lot on her plate. It's same with Mariam, but then Mariam should do that.
I know everybody's working hard.
Everybody's working so hard, pulling several shifts, but we're doing good.
Okay, so Mariam, I hope you hear this. Otherwise, we'll Putu will remind you that if you could kindly pick up contact with Dr. Elia and demonstrate the preparation of the templates, and then the template that is particularly for Tanzania, we will then put it into processing. So that is good. Then Dr. Jeremiah, we had yesterday already also a discussion. I'm just saying it here for general sharing, but also in particular with Tanzania, that we need to see what kind of approvals we need. It's a little bit different everywhere. In some places it goes directly through the ministry, and then the ministry directs the health facilities. In some cases, like in Kenya, it is a direct arrangement with the health facilities, but there has been an information tool, in this case, Camry and the ministry or the county level. So in Zimbabwe, it is completely localized in one locality only, where we will include selected health facilities. So what do you feel is the right arrangement, and how can we support that? Usually Francesca will then write as coordinator to from VODAN Africa to your clinic, or the person designed in Ministry of Health. How would you like us to follow that up, Dr. Jeremiah?
So I think we will need to start from our local place. Then let me ask, I will have to ask the head of department if there is need for advancing the information to the Ministry of Health. But as for now, because it's kind of start, I think there will be just some authorization of kind of study, like the way we do institutional review, things like that, which will approve this kind of start, not like we are starting and doing it completely as ready. So maybe we start doing it in terms of a kind of research way, the way we approach research, that should be how it should be done in our institute.
That's perfect. So in that case, then I think Professor Francesca, you could send the letter to Dr. Jeremiah and his well, whoever the superior is that should receive it, and then also the data management agreement would be signed by someone that is responsible for that in the clinic.
Yeah.
Right, Prof. Right.
Excellent, wonderful. Dr. Jeremiah, anything else that you can think of in terms of the discussion?
Currently, hope is well shared, and we will communicate on if there is anything that I will need to share.
Excellent, wonderful. Good. Then I wanted to pick up the issue, Francesca, of the publishing of the hosting of the fair data points. I see that Rudewan is here today. I know that you were going to pick it up with our friends Molly and John from Google.
From Google.
Yeah, Rudewan was available also to work on this particular thing. So maybe when you write on this, you copy in Aliyah for the general architecture and Rudewan to follow up on this particular issue from a technical side. What do you think?
Yes, absolutely, Prof. I had in mind to copy Rudewan because you and I have been the ones talking to the Google people. So I will also copy in Aliyah and introduce our role to Molly and Megan.
Good, great. Wonderful. Then Esther Inau, you are here as well, and you sent a kind of a short first initial summary. I know it's for me to respond to, but on the comparison between VODAN and the WHO new proposal of smart data. Do you want to say something about the initial comparison that you did? Because I thought it was quite interesting to see how close the two of them are, and it might be interesting to share that here. Esther or Inau. Esther, can you hear me? Well, if
hello,
yeah, Esther.
yes.
There you are. So I was asking, would you share on the comparison between SMART and VODAN, the very initial comparison that you did, because I thought that was very important to share here actually, because there's so much similarity.
Yes, there's so much similarity, and there's also very much difference in terms of I think the goal is the same with regards to how far my analysis has gone. The goal is the same, to make data interoperable and reusable and findable and accessible, just in different words. But I think the approach is different, and who it benefits is different. So for example, I don't know, how much time are you willing to give me for this? Because I could really go on and on.
Well, you can go on a little bit because it's a really important point. And you can also put, if you want, you can also put on your camera that we see you, but we can explore this issue a bit more. Yeah.
Okay, so I would like to share my screen then in that
Sure.
case.
Aliyah can give you the...
Oh, I think I already have my...
Oh, okay. Yeah.
So we're doing a smart versus fair. I think now you can see my screen better. So right now I'm looking at who does it benefit. These are the attributes I'm looking at right now. And it's something I okay. It's something that I am trying to, as I read on it, I increase on the attributes or on the stuff that I would compare the two against. So for example, I've looked at the origin of the concept, the domain, why was the concept developed and for who it was supposed to benefit, how has it evolved since its first development, how has it been implemented, who stands to benefit, and what is the structure. So far, that is what I have looked at as far as comparison. And you know, they're all very different with regards to those five or six attributes. I've also looking to start comparing case studies, and right now the SMART guidelines have been a case study. Right now, the WHO has posed the antenatal care package, which they developed a digital app for. And so that's the case study I'm using, and currently that is the only available case study, because it was, you know, the SMART guidelines have been published only a few months ago, as compared to the FAIR data principles, which were published as about maybe 5 years ago with the 2016 it was. So 5 years ago, and therefore we have more case studies that we could use, but I have chosen just because I think it's just because I've studied it before, the FAIR data principles for the open source registry for rare diseases. So right now I'm comparing the two. What I need guidance on, Professor Van Ryzen, is how to compare the two, and like, what would you like? I just need a lot of advice, like how to go about it, what to look out for with regards to case studies for these two, and if at all this is even something that, any direction that I should be taking for this particular course. Yeah.
Yeah, I mean, I think this is great work. Esther, what I would do is maybe distinguish between the FAIR guidelines and VODAN Africa, because VODAN Africa is a particular implementation with its own, in a way, origin and its own principles, such as the data localization, the data visiting, which of course is also part of the FAIR possibilities. But then in VODAN Africa, it becomes an implementation design where a number of principles have been agreed from the start. So I think it will be useful to distinguish. And Gert-Jan, I'm thinking that in a way you could really use this comparative analysis to also include HMIS, DHIS, what is the one? Impelo from Zimbabwe, the Tanzania system. So in all of these systems, really look at what are the core things that are in terms of responding to a particular problem. What is a problem that is being resolved here? And then what are the implementing guidelines for it? And then what are the implementation choices that are being made as a result? That would also give us an idea of the coherence between VODAN Smart and these HMIS systems. What do you think of that, Gert-Jan?
Yeah, this is fantastic work. This is very important. And indeed, there are two directions this can go. One of, what does it mean in practice? Eh? Indeed, VODAN is one of those implementations. Maybe there are others. Maybe in Germany, maybe here and there is something happening on interpretations of the FAIR principles, and also doing that on the smart side. I think that's still mainly within WHO. They may be using it for their own way of explaining what they are trying to do in digital health. And so that is to the practice. Then there's also a philosophical part to it. You could also go explore higher, from which kind of philosophy is this coming, and what in that philosophy is being seen as being solved. What reality does it cater for, and for which reality therefore it does not cater, especially in our environment with the African philosophies and European philosophies which divert. It might be a very interesting route. So there could be two ways to go to.
Then if you are speaking for this group doing the comparative work, then may I ask, Esther, are you then willing to work with this group on doing the overall comparative analysis? And that could be a very nice article then for the special issue. Then I will work with you on the comparison Smart VODAN FAIR, which I had already promised. And then you could liaise with the group that works with Gert-Jan on the overall comparison of the HMIS systems. What do you think of that, Esther?
I think that's perfect. For me, it works, but I am a PhD student, and I also have my professor here in Germany. So I would like to, but I have to run everything through my professor, at least inform and let them know that this is the plan. So far, she's okay with what's going on. I just need to keep updating, and if any concerns come up, I need to communicate. My professor would like to be part of the team that works on the conceptual approach for this, the analysis of the concept. Is that okay?
I think so. I think we should invite your professor sometime here. I'm very curious to meet her. So okay. Maybe we can arrange that, Esther.
Wonderful.
So we'll take that up, and then we will do that for one of the future meetings.
Okay.
Good. That is excellent. Yeah. Then another issue that came in was initiative, Gert-Jan, that you have to, you've discussed with a number of people kind of in a explorative way. If we would look at VODAN in terms of its, in how it audits as an open source project. And it is maybe good to put it here to the meeting so that then we can hear feedback and what people think.
Yeah, thank you. Indeed, there is in computer science and so on, there is this terminology of free and open source software, which is in itself a sort of a principle of transparency. Now, of course, at VODAN, we are very transparent. All the recordings of the meetings are on websites. But those are more from the government's point of view. The discussions are very public and so on. But the free and open source software environment has a sort of a method, a way of making the whole available, and the source code on GitHub and this and that. So I would want to discuss, because if VODAN is being seen as providing their work as free and open source, that would really be a strong position to have. Many people do that, and not everybody is really doing it then. You know, it would really position Vodana very much in a certain area and as an open platform. So it's not only sufficient to put the recordings and the documents public, but also the codes and the different versions and allow people to interact. We have many computer scientists in our group, so I'm sure they know what we're talking about. But it is something to bring it together, and so everybody can understand that we are open and that whatever we produce is also free and open source.
So this is a proposal. This is not a decision. It's a proposal. And who would like to? I mean, is there any initial reaction? It doesn't need to come to a decision at this meeting. Just to hear something back on this. Who would like to speak to this? Francesca, I think everybody thinks that you'll be the first to speak on this.
I think there is a question from Bert.
Can I say something about it?
Yeah, sure. Go ahead.
Because I think that when you look at the software, when you look at the fair data points, these are really open source. And also when you look, for instance, at the CEDAR software, that's also open source. So what we see is that there is already a lot of open source, let's say, underneath the project as the basis. So I think if we are still working on additional software interfaces, for instance, and we make that open source as well, then we can really claim that everything that so far has been published will be open source. So also within the foundation, we're always claiming that we want to have as much as possible open source software, so that there will be no risk of vendor locking or other type of other lockings. So that is something that is, I think, up to now, has been well preserved.
So I take it that you are supporting the idea that Gert-Jan has put.
Oh, very much, very much. Can I also say something about SMART? What Esther did. I think that is a very useful, good exercise. I also saw a lot of overlap. I already spotted it in the newsletter that was sent by Obina. I think it was last week. Let's say what I'm curious for is how to define the T of SMART. When you look at the T, it stands for the testing environment. I have not seen any principles within FAIR regarding real testing. So if the SMART principles have something around testing, that could be very interesting, I think, and we could use that. The other letters I seen that that is overlap with the reusability and the interoperability and the machine actionability. These are things that are almost embedded in what we are doing here. But the testing, it could be a very interesting extra element.
Thank you, Bert. Very valuable. Sakina, did you hear the discussion we were having? Hello? Sakinat? It's maybe not a good connection. Francesca, are you hearing?
Yes, Prof. I'm hearing, even though I have some limited connection because I'm moving in between cities. I lost most of what Beth said.
Okay, so the proposal that we were discussing was to look at the free and open source software and do an audit on VODAN, on the adherence to that. So Beth supported that idea, and we were just wondering what your thoughts are on this.
Sorry, Prof. I'm having difficulties getting that. What is the proposal?
Well, Hejan, can you repeat it?
Yes. What I'm proposing is that we are putting free and open Vodana to be free and open source software as one of the, its principles, and align the way we provide the information on the software and where we put it aligned with the FOSS community. They have a way of doing that. So the current way of doing it that we are publishing for Vodana, which is very transparent, is not necessarily aligned with how the free and open software community does it, GitHub and all those kind of things. So just to align that, so we can indeed claim to be free and open source software.
Okay, yes, that's absolutely fine. And the work of Getu
So
I could take it up with Samson and Getu when they return to Addis.
Yeah, I think that is perfect. So then that's a second project, Hejan, for you to discuss that audit with Gitu and Samson. They'll be back. They'll be here on Monday. So next week they'll be attending all the meetings. Okay, then we have really progressed well. Obina, do you have any thing that you want to update? You have sent a newsletter, which is really nice. I saw that there was another request for an update from the Go Fair Foundation. So maybe we can look at that also. Obina, do you want to speak to this?
Hello, Prof. Good evening.
Hi, good evening.
Okay, I didn't get the request from Go Fair Foundation.
No, I can send it to you, in fact.
Okay, okay.
And so you have done the newsletter. You have also done all the information for the facilities that is basically ready. Do you want to give a quick update on that?
Okay.
Please go ahead. Obina?
Share the screen. I'm trying to share the screen.
Sure.
Okay. Okay, I think, can you hear me?
We hear you fine, yeah.
Okay, this is the documentation that we're going to present to the Ministries of Health in Zimbabwe, Ethiopia, and I think Zimbabwe, Ethiopia, and Uganda is ready right now. So subsequently, we are going to update. We are going to update for. We're going to update for
Nigeria, for Kenya,
Nigeria,
for
Kenya,
Tanzania,
Tanzania, Somalia,
Liberia.
and Liberia. So okay, so it contains the okay, for instance, this is a Vodana data verification project for Uganda. It has the executive summary, then the situation analysis, executive summary presented what Vodana Africa and Asia is trying to implement, then the situational analysis, the current situation of things at the clinic and health facilities in the participating countries. Then it also has the information on the benefits, on the benefit for the health clinic, how they are going to benefit. For instance, here, real-time access to data. There will be a dashboard view of the data at the Federal Ministry of Health, clinics and hospitals. So information on the benefit for health clinics, and okay, here is a continuation of the information. Then this is a deployment strategy, how we are going to implement this in these countries and in these 20 health health facilities and clinic and hospitals in these countries, and these are the layers of access control. So the information is very clear. We try to make it simple and straightforward, so people are not going to be bored with many details.
I think it's a really great job, Obina. Really, congratulations. Looks fantastic. I would say that there is a very deliberate decision here to really name the project Vodana. And if this is the decision that we have made or that we make here today, I don't know if today is the right time, but then I think we need to drive it really in all of the communication, because I think we still use very much the different names as they have come from the past. But if we want to have recognition and visibility, then it's important that we really have one way that refers to us. So do you think, Obina, that Vodana is the right way, or that we already have a lot of track record in Vodan and we should stick to Vodan Africa and Vodan Africa and Asia? How do you see it from a communication perspective?
Well, I think it depends on the stakeholders that you are trying to communicate to. Then another thing is officially depends on what we are projecting ourselves as officially, whether as Vodan Africa and Asia, or Vodan Africa. So officially, if we are Vodan Africa, then you have to maintain Vodan Africa. But officially, if we are Vodan African and Asia, I suggest that we have to stick to Vodana.
But that means that we have sort of two split abbreviated names, which might also dilute the clarity on our identity. So I think it's important decision to get it right. If you see
Yes.
what I mean, right? I mean,
Yes.
because you become Vodan Africa, you become Vodan Africa and Asia, you become Vodana. At the end of the day, people are going to think these are all three different things, but it's not.
Okay.
But it is really a communications thing, and I'm not a communication expert, so I think we need to go on good advice.
Okay. I think maybe you have to stick to Vodana. If you can stick to Vodana, I think it's fine.
Professor Miriam, is it okay that you and I take this off list?
Yeah, we can.
Yeah, given the position of the steering committee, the consortium, and of course the Modern Africa board on the issue of nomenclature.
But then we should decide to do this offline in the next day, so that Obina can make everything consistent.
Yes, we can actually do it. Yes, we can even do it on WhatsApp after this meeting. Once I'm able to get somewhere to charge my phone, it's fine. We can do it today. I just want to kind of remind you of some of the, and then it's also due to the sensitivity around that name. So we take a decision on that.
Sure, that will be a pleasure. Okay, then I'm going to Dr. Sakinat for the update on the special issue. Dr. Sakinat. Sakinat, or otherwise Misha.
Dr. Sakinat is not on the call, so I think Misha, yes, Misha, right. Thank you, Misha.
So there's not much to update. Most of the articles have remained the same. There's been a bit back and forth. Hello? Hello? Can everyone hear me?
Yes, Misha, I can hear you.
There have been some articles that have gone back and forth between Susan, but there's nothing really new to update on. Okay. Any? Hello?
Yes, Misha, thank you. But then there is this article by the DSW team that was started and is now stalling, and we need to take a decision on the article. I know Marek already written a couple of emails or so to us on the issue, and there was that argument that it's actually the DSW team that should take leadership on that article. I don't know if Beth would look into that, because it is their product, and even though VODAN Africa was the first to actually implement the DSW, but we feel everything about that the leadership on that particular article should come from the DSW team.
Okay, I've not been in contact with the DSW team on this part, so I'm not really up to speed here.
So perhaps you can find out then a bit. We have one article, Article 2, which refers to the experience on the VODAN in a box. That article is pretty much ready, but the one on the DS Wizard, that one is kind of stalled. So if that is to be documented, which would be good, then that needs to be done by the DSW team.
Okay, I will ask them to, I will check where they are, and if there's a hold up, I will find out.
All right. Okay. Yeah. At this moment, there are between 12 and 14 articles that are close to being ready. So we're really getting very close to the first special issue of VODAN then. And then we will concentrate on all the articles for the second special issue. So then for next week, I wanted to ask Dr. Sakinat. She agreed to give a presentation on a very nice article that she and the team have done on the machine learning analytics over the FAIR data from the first proof of concept. And I would also like to discuss at some point the strengthening of that team with Noor, who has joined us, and Yilin, who will be working also on the dashboards and so on. So this we should also start discussing next week. We can start that discussion as we get the presentation from Dr. Sakinat on the analytics that they performed on the first part of our program. So that will be there for next week. Putu, do you think that we will have a meeting for access and control on Monday, as usual? Is Putu still here?
Yes, I'm here, Professor.
Oh, yeah.
Yeah, I think I can continue access and control.
All right, and then Aliyah is going back to the architectural issues on Monday. Gato and Samson will be back, so there should be a lot of progress then also, because they went to Mekelle with homework, including testing the machine readable templates offline. So hopefully they'll come back with some information, some interesting information. So yeah, that's all for now. Thank you everybody for joining. And back over to you, Alia.
Yeah, thank you very much, Professor Miriam. Thank you everyone for joining this meeting. I would like to wish a very wonderful week. And with that, I would like to close this one. And yeah, have a nice week and have a nice day. Yeah, thank you.
Have a nice week.
Thank you. See you next time.
Have a nice week.
Thank
Bye.
you.
Bye,
Bye-bye.
Olewale. Bye.